So I'm going to introduce at this time Dr. Gabriella Ali, and Dr. So there we go. Sorry, it threw me. Hello, Dr. Gabriella Ali and Dr. Rob Rutledge. I'm so glad that you have joined us. I apologize. We ran a little over, and I hope we're not going to throw you right off, but you will have full presentation time. We're looking forward to this. And how apropos that we've had these patient stories just before you starting, because you are going to talk all about this new patient program, this patient empowerment engagement program. I'm so excited to hear about it. And it's a full scientific research project that you've been undertaking for quite a long time now, and are now traveling the world. I know you've just come back. I don't know how you're coping with the jet lag, but I'm so grateful that you joined us. So I'm going to let you take it away, and we'll ask you questions once it's all over. Thank you for coming.
Wonderful. Actually, why don't we, before we share, why don't we just just let show our faces. So thanks a lot, Christine.
Thank you, Christine.
Yeah, it is just a real pleasure to be here as well. Gabrielle is an endowed scientist in cancer quality of life research, and I'm a radiation oncologist. I've been
treating kidney.
Yeah, I'm treating kidney cancer for over 25 years now. Yep. And we just came back from a conference of about 80 Canadian radiation oncologists, all of whom treat kidney cancer. And I have a couple of reflections from that talk. One is it's so good to see that the billions of dollars of research are actually being converted into new treatments so that kidney cancer survivors can live much longer and do incredibly well. And there's just always this hope that the next drug is going to be available and really kind of make a difference in getting home runs for people. So that was super exciting by itself. And the other thing that I recognize that we're using radiation more, for instance, if a cancer spread to a bone, for instance, they would radiate that spot. And even kind of combining the immunotherapy with the radiation, it seems like your immune system, you have a kidney cancer diagnosis, your immune system actually really can play a huge role in it. So the radiation kills some cancer cells, and then the immune system recognizes those are abnormal and then starts to kill off the cancer cells at other places.
And this is where this program kicks in, and it fills a gap really in the literature, in the scientific literature, because through patient engagement, we understand the importance of lifestyle choices in working in combination with the various forms of treatments that we have available to really help you, empower you on this cancer journey.
Yeah. So what we're talking about is that combination, getting the best care from the medical system, using that kind of scientifically based stuff. And then we're science-based as well, but it's the kind of empowerment piece that can actually influence your immune function. Yeah. So the two together, I think, is the most powerful way that people can give themselves the best chance of healing. And a lot of kidney cancer survivors are going to live for many, many years after the diagnosis. And so they can influence their health in lots of other ways as well.
And what I like about this is the fact that you have power over your lifestyle. Yeah. So you do have a very important, I would say, quintessential role to play in the healing journey, your cancer healing journey. So we're not passive observer, that there's a sense of autonomy. There is a sense of, look, there are some changes I can make with regards to perhaps what I eat, with how I move my body, with
stress reduction,
the choices that I make in terms of social support, the choices that I make in terms of my communication with others in my immediate circle.
Beautiful. And there's science. And that's the wonderful thing, is that we're garnering the best of those kind of health promotion science, creating a very comprehensive package. So
because otherwise the science ends up, sitting on a shelf. I mean, the clinicians will read it, but then it never gets translated to the people that will benefit from it. Yes. And that's you.
Yeah. There's our conflicts of interest. It's not really much. This is what we're going to cover. We're actually going to recognize that if you've been given a kidney cancer diagnosis, that does cause increasing stress and distress levels. So we're going to talk a little bit about that literature.
And then we'll talk about how that literature fits into our life with our lifestyles, and how actually the two merge in a story, in a narrative that actually intersects with your treatment modalities?
Nice. Yeah. Gabriela has been leading this amazing lab. There's a randomized trial that we've actually been able to prove that by doing this program, the guys with prostate cancer, at least, can really improve their mental health and other outcomes, but we'll talk about that shortly. And lastly, we're going to talk about the fact that we're going to be offering this program to people affected by kidney cancer and other cancers. And so that's coming probably within a month. And we're really hoping any of you who are listening who have a cancer diagnosis can kind of join that program as well. So, can I brag about my wife or not?
Okay, you go ahead.
We're also husband and wife.
I paid him for this.
$50 goes a long ways. So Gabriela started as this endowed scientist in 2016. She really literally knew nothing about prostate cancer. So prostate cancer was the start. Yeah. Immediately went to the experts, which are the people affected by prostate cancer. So the support groups, went to clinicians. They didn't actually know how their patients were doing.
That's true. Ultimately
had to actually do a very scientific way of kind of assessing the needs of the patients.
Yeah.
Right. And then we've had patient conferences. It's been step by step, scientifically, methodically creating all this. And through this, therefore, we had a phase 2 trial, which is a feasibility trial. Sorry, I'm talking a lot of time, but I'm very proud of Gabriela, a phase 3 trial, which is a randomized trial.
Makes my life easy.
Proving that it's actually helpful. We're on a phase 4 trial right now. And as we're saying, we're expanding this to other types of cancer. So I can't do it justice, like everything that she's done here, but at least, there's been a methodology over the last 6 years.
I think the key here is the fact that we engage the patients right from the start.
Yeah.
I mean, really, I like this slogan, nothing about me without me. And I think patients play a very important role in survivorship care and in treatment care. And it is very important to activate that role and that autonomy of the patient in this process.
Yes.
And you've heard from a couple of patients right before our presentation just how important that is. And it's non-threatening to physicians.
Yeah, well, so most physicians, some have frail egos.
It's true.
Yeah.
So this is just a synopsis of the many golden standard questionnaires that were implemented in our phase 1 trials, looking at a plethora of things just to try to understand what are the needs of the patients, because on the basis of that evidence, then we can tailor integrations to patients' needs. And so what you see here is a synopsis of the many golden standard measurements that we used that are known throughout the world, things measuring mental health, quality of life, of course, urinary function, bowel function, sexual function, but also, like you said, personality, life satisfaction, illness perception, treatment regret.
Yeah, this was pretty extensive. And
the results came back.
I'll give you the very quick synopsis because you could kind of figure this out. So these are unmet needs, right? Intimacy, sexuality,
feeling alone,
fatigue, there's lots of different things that guys with prostate cancer suffer from. And I'm also just thinking about the kidney cancer folk as well.
And we'll see in a second that actually they're not very far off from what patients with kidney cancer patients are suffering from. But where the shock really came for me was just how much our patients were suffering. And this was what unknown. So back in 2018, there were very few, especially population-based studies, almost none. The majority would have a sample size of 100, 200 people. So, we have a substantial sample, about 500 maritime patients. And what we find out that the rates of anxiety, depression, or both are more than double of those of men in the regular population that never had a cancer diagnosis before. And this is really interesting because you look, subsequently, we looked at independent data sources. So we went outside of our database thinking, look, if this is indeed a relationship that is found in the population, it should be found in all population-based data that is out there. Yeah. So the Atlantic Path data corroborated those results. A sample of about 6,500.
Canadian longitudinal study as well.
Another 25,000 men.
Denmark, et cetera, et cetera. So what I wanted to do was to share the kidney cancer side of it, because we did those side of it sides of it as well.
Yeah.
And what it basically showed, and it makes sense. You think about your own journey as a kidney cancer person. 90% of people are going to be really distressed in kind of going into immediately after starting treatment. Sorry.
That's right.
And that you can think about, well, what are the risk factors? What are the people who are really hurting? And it's obvious that if you have different stressful situations, prolonged treatments, advanced stage, there's metastatic disease, there's lots of things that can put you even higher risk of, being, anxious and having depression, et cetera, which is all normal, expected stuff, right?
Including genetic factors.
Yeah. And the other, the international studies, it would make sense. 1 in 4 kidney cancer, bladder cancer patients are suffering significant anxiety, depression, or both during survivorship.
Mm-hmm.
I've heard cancer patients in general, it's like 1 in 3 at some point are going to have some significant issue. And the last sentence there is, this affects how they actually get the treatment. Yeah. They're not able to get the treatment as easily if you're feeling so stressed and or having depression.
And what we're seeing across the board, because we're talking about all forms of cancer here, is that the reality is that we have very poor evidence-based. Mm-hmm. We lack the evidence to really create survivorship care programs that are tailored to patients' needs.
Yes.
So I will explain this a little bit because I think it's important, it's very pertinent. Most of the mini interventions that we have for survivorship care, they come top down.
Yeah.
What does that mean?
Do this exercise program.
Yeah. Do this exercise program, eat this.
Do this.
Go to the support
but just
group.
Do one thing, yeah.
Right. 1, maximum 2, perhaps 3, but they're not evidence-based. In other words, the setup, the design has not been drawn from randomized clinical trials, for example, which would be very important because there is evidence out there, scientific evidence, to feed into evidence-based programs, but we don't have that. And that's really across the board, all forms of cancer. So what is, I think, important is to bring the voice of the patient back into the medical system by inquiring directly from the patients, what are your needs? What's actually happening there? Yeah. And then allow this, what we call bottom-up type of information coming straight from the patient to meet the scientific base and meet somewhere in the middle. So neither one approach alone is not good. And of course, about a lot of, groups out there that will come bottom up. Oh, I have a friend who is a physiotherapist, or I have a friend who, is a chiropractor. This program will be really good for cancer patients. And I'm not saying that perhaps it is, but it's not scientifically based.
Yeah, I would say tap into the resources. Like you can do a scientifically based program. We can tap into other resources. Kidney Cancer Canada is fantastic resources as well. So there's lots of different ways to make it work for you. What we thought about when we're talking about cancer patients now is we wanted the scientific evidence. We wanted patient and expert input. So it was, health promotion experts. Who is a psychological expert. There's science around how you work with your psyche and your relationships. And we also wanted to consider that certain treatments have certain side effects. We have to kind of address all of that in a comprehensive program, which is, unique. It isn't
and it's very ambitious, actually. We didn't think this is going to work at the beginning. That's why we engage everybody.
Phase 1, phase 2, phase 3, phase 4. Yeah. So we knew that patients have high levels of mental health issues, right? So depression, anxiety, it's normal, it's expected, and it's influenced by the relationships and so on.
And some cancer groups have less attendance to support groups than others. So for example, a perfect example of this is the prostate cancer group versus the breast cancer. You have very high attendance group. To support groups in breast, but very low in
prostate. And then, you have the scientists from a kind of psychological perspective. I was also thinking as a physician, it's the combination together, right? Thinking about brain fog, the fact that your brain may not work as well. Fatigue is the number one issue. I'm thinking about your immune function, especially. There's also this idea of prehabilitation. If you're due up for a nephrectomy, get your kidney out, you would actually want to be in better shape prior to going into the operation, right? So we want to kind of bring all those together.
And there's so much scientific evidence to show that prehabilitation actually works. So why not take that wisdom and put it into a program that helps?
Exactly, right from day one diagnosis. There's medical comorbidities, which basically means you may have some other condition, such as like heart disease, or you might have diabetes, you might be a little bit overweight. There's other things we have to think about to try to really maximize your health in all realms. And lastly, this is really about you being well and happier many years from now. So how can we influence behavioral change? How can we actually help you over a 6-month period, for instance, get into those habits, the automated habits that actually allow you to be healthier and happier.
And talking about science, Rob, there's a lot of scientific evidence to show that to really change somebody's behavior, first off, you need a certain length of time. You can't just do it over 2 weeks, 3 weeks, 4 weeks. And number 2 is there is a recipe. You need to prescribe. You need to describe why that is so. And then you need to demonstrate.
Model it as well, all together. So brain health, gut health, bone health, all in the mix, right? So we came up, again, expertise, bottom up, top down. We're thinking, no, this is for the prostate cancer program. And so it would be similar for people affected by kidney cancer. Had to be appropriate for older people, home-based to make it convenient and accessible, had to be safe.
Little that we knew about COVID.
Right, exactly.
Makes it even more important.
We just talked about the length of the program. The clinicians have to be able to get the patients in, or the support groups, Kidney Cancer Canada has to be able to get them in. We already talked about science and evidence base. Lastly, this is so important, this idea of organic, because the science shows that if you just say to people, go to this website and do this little thing by yourself, you're going to be better. Now, some people are super motivated and will do it, but we know that it's like 90% of people kind of give up on the kind of sterile inorganic. So as part of our design, we wanted to make sure that we kept it human to human, interactive. We had to have that kind of true feel, true connection.
Yeah. Plus, I think, and just to complement what you said, if we create a set of videos and then the experts behind it are not there, then it's really hard to have that sense of continuity, expert continuity. And also, there's another issue. The science changes all the time.
Yeah.
I'm sure you heard earlier in the day from the kidney experts.
Yes.
Exactly. That we have new treatments coming and new evidence and new information that is very pertinent to survivorship care. So therefore, it was very important to find a program or design something that also allows for those continuous updates,
integration,
and allows for this type of continuity.
Hopefully you're hearing ongoing monthly video conferences, which was one of the solutions to that side. So PCPEP is the name of the prostate program. CancerPEP is it. Okay, so here it is. Let's go through this reasonably quickly. 6 months every day, no matter where you are in your journey, you get an email for 6 months in a row with a daily email prescribing, saying this is what you need to do. And then there's also a daily video that's 3 to 5 minutes long. And I think we've got one of those to play today as well. I think we've got the time for it. So there's an example of the video that we get, and there'll be links to the different videos that they would watch that day, including the daily PEP video. Okay, so here's just a quick glimpse of some of the little daily videos. We're talking up vitamin D. We're talking about diet.
And notice that we're in a home, even now.
Yes, it's the same background, etc.
Yeah.
So, and this is
it's home based. We're also people, and that's important for people to know. Experts are also people, just like us, just like all of us.
4-minute video now. Interrupt us if you can't hear the sound.
Well, hello, gentlemen. This is day 111. Number 11 happens to be my favorite number. So I'm very happy today.
Wonderful.
Yeah. Wonderful. So let's talk about nutrition. First, we want to talk to you about what he's saying. Oranges. Okay, they have vitamin C, thiamine, folate, fiber, calcium, and potassium.
Wow.
They are a powerhouse for fighting cancer. In fact,
right. It's vitamin C is the main ingredient that allows antioxidant function, right? So it locks up the more dangerous chemicals.
And they're known to find 3 different radicals.
And the radicals are the ones that cause the damage to the cells that cause the cancer.
There you go. Very good for diabetes, reducing diabetes, improving heart health,
skin. Otherwise, I suggest that you get your orange juice by eating oranges and not drinking orange juice, because when you drink it, the sugar gets absorbed into your bloodstream too quickly, right? So you want to be able to eat the fiber and get the slow absorption of orange. I like eating at the end of the meal, so you got enough other protein in the gut to allow for a slower absorption.
And talking about orange fruits, because it is Orange Fruits and Vegetables Week.
Aren't you glad we just talked about this?
Oranges and mango make an amazing salad. And if you have some grapes, next week we'll be talking about pink fruits and vegetables, ladies and gentlemen. We're excited about that, but it makes a lovely salad. And like you said, I really like also in the morning, remember the green smoothie that we recommended, the one that you treat like oatmeal and then you decorate on top with nuts?
Yes.
Well, we made one this morning, and truth be told, because you have to put a whole orange in it and a lime or a lemon, and then mangoes. Really half of that container was orange fruits.
Orange fruits.
Of it.
Boom.
And then you had, turmeric on top of it.
Yes.
Really.
scary how healthy it is.
Mostly oranges and green stuff. I mean, it's really fantastic.
Yeah.
Jens, it's just amazing for us to be able to pull together as a community to eat healthy and choose the best healthy diet for ourselves to ensure we have a good quality life. I think it's fantastic. And I'm so happy that you're joining us and that we're doing this together.
Exactly. Well, think about it. The other advantage of having a mostly vegetarian-based or plant-based diet is that it's much more efficient in terms of food production and much better for the environment.
Oh, thank you for saying that.
If you choose the plant. So it helps kind of community, environmental, world level. So
it does. It really does.
Yeah. Yes. So making those choices. Yeah. And the fact is you guys will have an influence on your family and friends, right? Yeah. You're setting the culture so that younger ones can take up the torch of the healthy diet that's good for your heart health, your brain health, your prostate health, every type of health.
Yeah.
And environmentally sound at the same time. So yeah.
Wonderful.
So Friday, work hard, vitamin D, do your goals, your heart rate variability monitor.
Sing together. Sing together. Sing together in terms of intimacy. What's wonderful about that is that breath is about life. It's a very, very healing form.
Good, yeah. So you gave a flavor, and we always feel a little bit uncomfortable about this because we're being kind of open and intimate. This is 111 days into this program. They've heard us for 111 days. There's more of a relationship there, whereas you guys just coming in going like, ooh, these guys are kind of a little bit out there type thing. We are kind of pushing the science. We're trying to be vulnerable, culture vulnerability.
I want to show them that actually we are people too. So a lot of the times, they see us very late at night, perhaps coming straight from work and not having eaten yet, or, and things like that. So that also shows them our humanity and perhaps, lowers this idea of the standard that, experts are up here and, as a patient, I'm down here. Well, we're all human. We're so much more alike than different.
I'm just going to quickly zip through what we're actually recommending during the 6 months. So I'll just flick through this. So, it's 30 minutes per day, 6+ days a week, not sitting so much was the anti-sedentarism part. So that's pretty obvious. There's a strength training, and that will also be part of CancerPEP. Gabriella does a slightly modified version to make it easier. So essentially people watch videos on Mondays and Thursdays. There's 4 levels of difficulty.
And then in addition, here in the corner, you will see a picture of me, and I usually take the less advanced forms of exercise just so that we have a spectrum.
A spectrum and just keeping it easy. The expectation that you would start out very easily and slowly increase your activities.
And we also have yoga videos where actually we flip. I do the harder version and Rob does the easier version. Just to balance those gender differences and again, we're so much more alike than different.
Agreed. We'll just show you just a little clip of that. So Jeff, the therapist, is explaining exercise I'm demonstrating here.
And rest.
And then there's obviously a rest period. They last for about 30 minutes.
This next exercise is the chest press. You're going to begin by standing with the band attached to the wall. You're going to use the bands to provide resistance, and you're going to press all the way forward.
So this is an example of workout A, which is on the Monday. It's basically a whole body therapy and very helpful. Next, we have meditation. If you go onto a CancerPEP, it's part of a trial. Half the people will get this HRV monitor, which assesses the kind of heart rhythm, teaches you how to decrease stress. Half people will get that after a 6-month period. Again, very strong science show that you can actually decrease the kind of stress level and do that, being able to do that on cue as well through mathheart.org. Again, very scientifically based type thing. The dietary advice, you got to feel for what we're talking about. I mean, it's kind of like a constant reminder, try these things, swap out the unhealthy stuff, get more fruits and vegetables. You're not going to get a perfect diet, but we think you can get a better diet. And the hope is it will last over many months.
And we learned actually from our prostate program that, a lot of the gents and their wives were saying, you know what, we wish we had a few very specific cancer-specific recipes. And so we put together 26 weeks of videos that take you through entire recipes from the beginning till the end. Yeah. We make jokes. I say, well, listen, if an oncology can't do it, it's okay.
Exactly. She's teaching me actually in the kitchen, which is which is lovely. I'm becoming more proficient there.
Yeah.
There's a science to improving a person's relationships and their ability to connect and the kind of intimacy within their lives. So, for instance, we prescribe walking Wednesdays, which is every Wednesday, try to go for a walk with somebody, right?
Yeah, yeah.
There's call somebody
Call
at,
someone at a distance.
on Sunday. There's touch Tuesdays, whether you live alone or not. So there's lots of lots of science around it.
And we normalize this idea of having emotional needs because we all have emotional needs. So the question is, how are you going to meet them? Also, we talk about things like love languages. We have different ways, just like there are different languages are there. We have different ways of receiving love when somebody gives it to us. And we're not just talking about, oh, I'm just talking about your wife or your husband, your partner, what have you. No. We're talking about emotional needs in day-to-day life and how do you meet them? So by interacting with people, with children on the street, with neighbors, with co-workers and so on.
We're kind of running out of time, so I think I'm going to take it a little faster from here. There's social system in the cancer program, partner support. Essentially, we're asking the guys who want to call 2 other folks there. And then the Zoom video conferences are super important because we give a scientific update. There's small group discussions. It's part of CancerPEP will be actually every couple of weeks. So it's a way to keep it very organic and connecting.
Yeah, and up to date in terms of the scientific evidence.
Every week we ask people to fill out what they actually did that previous week. And it's actually a reminder of the very comprehensive program. Lastly, I just want to go over quickly. It's not fair to the scientist here, because she's worked so darn hard, but essentially it was a randomized trial of men scheduled for surgery or radiation for prostate cancer, looking at mental health at 6 months as the primary outcome. So half the guys just did the standard of care, you get in the medical system, half of them did that plus this very comprehensive program. And we looked at mental health. And essentially, you can see the kind of design here. We don't have time to kind of go through that. The assessment was at 6 months, and then there was a crossover in their design after that.
And so we approached 171 men, and of those, 128 actually remained in the study. 66 were assigned to the intervention and 62 received control. So what you see here is that the groups were actually very balanced at baseline. But notice that by 6 months, patients that were in the standard of care performed much worse.
The distress was higher.
Non-specific psychological distress and need for clinical treatment went up considerably, and it continued to go up. And so did their anxiety, so did their depression. And these results are clinically significant. When we compare the 2 groups at 6 months, the odds were 3.5 times higher for screening positive for nonspecific psychological distress and need for clinical treatment compared to the intervention group, who did much better. And even at 1 year, there were some differences there. The intervention did have an effect when they received it at 6 months, but wasn't as profound as it was when they received it as soon as they were scheduled for treatment.
Is it generalizable? It's not every person with a kidney cancer diagnosis that's going to want to or be able to do this program. But I would think like 1 in 3 probably are motivated enough to say, yes, actually want to take care of myself, strengthen myself, change my habits, et cetera, et cetera. So we're hoping that will go well. And just to quickly say that the phase 4 trial right now, which is part of the prostate cancer world, we have 140 guys on this so far. We're trying to figure out which patients actually benefit most, which patients benefit least. We'll continue to look and adjust the program as need be. We're looking at safety, we're looking at cost. There's lots of different elements of our current program.
And the primary difference is that now we're looking at it nationally and internationally. So now we have 9 out of 10 provinces on board as sites. We have 1 international site in New Zealand. There are other countries that are waiting for the trial to be open there, Australia and several countries in Europe as well.
Yeah. So the phase 4 trial, we're also converting the PCPEP program into French by doing voiceovers and so on. And then Gabrielle has already outlined that, when the physicians hear about this, they go, yes, we need this. And when people have a cancer diagnosis, yes, we need this. So all to say, the last big pitch here is that we're going to open a trial for all types of cancer. We're just waiting for the Research Ethics Board to allow us to do that. It's going to be the same program essentially, except it's now a full new set of of daily emails and daily videos. So we've got to do this again, 182 daily emails.
And the monthly video conference now is happening
Every
twice a month,
Yeah.
so every 2 weeks.
Yeah.
So we have an addition of yoga videos for strength. And also we put together 26 weeks of dietary videos.
Yeah.
This has taken a substantial amount of time to develop, I have to say, but we're really proud because we engaged the patients from the start. We engaged stakeholders, clinicians, and patients as the program was developing over the years. And the fact that we have about 17 clinicians right now representing the program in the various cities, in addition to the provinces where we opened, it's really testimony to just how important we think this work is ultimately for you.
And when it actually opens, then we'll email Christine and say, Christine, please share this with your community. Then people can kind of contact us. You have to agree to a trial, like you have to be on a clinical trial. And eventually in the next couple of weeks, cancerpep.org, the website will be available. In the meantime, you have our contact information here.
If you need to reach us, yes.
Yeah.
Yes. And this is just a synop of some of our team members. Notice that we have research citizens. Those are citizens that have taken the program, and now they're mentors. They're also leads in outreach. So when we travel to various sites, they come with us and we have direct testimonies from them. So we're very, very happy to, and we engage them in our lab meetings. So patients play a huge role in this. Let me be very clear. We thank everyone for their support, but number one, the patients. We wouldn't be here if it wasn't for the patients. So really, thank you so much for giving us an opportunity to talk to you today about this work.
Yeah, thanks.
Thank you. Oh my goodness. I see that there's interest already in the chat. This is very exciting, and this is patient engagement and patient empowerment. The patient voice is what Kidney Cancer Canada is all about. And I know that we've had some conversations already on how we might adjust this. This CancerPEP program sounds excellent. And we will certainly share the information as it comes forward when the trial opens up, and we'll make sure that our patients have the opportunity. I do have a question. Do you have a top number? Is it going to be limited on who can join for this trial?
Yeah, so we signed up 100 people so far, but I'm pretty sure that we're going to sell out quickly. We'll have to go back to the RAB and make it 150 or 200, because I just think there's an incredible need for this program and people get it. What can I do to empower myself and make a difference in my life in the long term?
And I think the word is out because we're receiving already emails of interest, and we're keeping track of people emailing.
Yeah. So you can email us to say we're going to put you on the list, and
obviously
you have priorities.
That's a good idea. Yeah.
Okay. Well, this will definitely be on our website after, so people will be able to access your contact information. And those that are watching, if you have an interest and you don't necessarily see Gabriella or Rob's email, just email us at info@kidneycancercanada.ca, and we'll make sure that you get what you need. I don't have any specific questions. If there's anybody from the audience that would like to ask Rob or Gabriella a question, I forgot, I apologize. I didn't give you a little intro, and I just quickly want to say that I got thrown by.
We're normal people.
It's the technology, and it's nice for me to brag about my wife. So yeah,
it is. But you know, like Gabriella holds a very important position, and I'm going to pronounce. Gabriella, tell us what you are. I can't pronounce that.
I know. It's called Solchi. It's a Gaelic name for guiding light. So actually, the endowed scientist chair position that I hold has been endowed by two patients, and they have Scottish heritage, and so they chose this name for the endowed position, which is a great honor, to mean guiding light, because there was darkness before. We have very little opportunities at the level of the government to start looking at what are the exact needs of the patients and engage patients in this development. We have a lot of top-down and very small studies, as I said, very small sample sizes. The majority of them look at one aspect, perhaps, of lifestyle, maybe two, but not more than that. We have no evidence that shows that a program is that effective to decrease just in general psychological distress, but also anxiety and depression. So all three metrics, we don't have really any evidence. So him and his wife went through a very difficult time, and they said, enough. we will support such a position throughout the Dalhousie Research Medical Foundation, and they did. They endowed a position just the way, you know, any other organization endows positions, and it was very ambitious, you know, and there was no light, so you have to kind of. So how do you go about developing?
Yes, well, you're bringing light to kidney cancer
That's
world.
wonderful. Yeah. And Rob, I don't want to, you are an associate professor of medicine at Dalhousie University and a full-time radiation oncologist specializing in genitourinary and breast and pediatric cancers. So you've had a long-standing interest too in integrative medicines and you know, that kind of thing. So I'm so grateful that you both, and I'm having comments in the question and answer that these doctors are a joy to watch and very motivating. So you have
Thanks, Wendy. I'll pay that.
What you set out to do today.
I'll pay the other $50 later for that. Thank you. Goes a long way.
Well, thank you so much for joining us. I'm excited to see how it develops, and we will certainly be in touch.
Great.
Wonderful.
Thanks, Christine.
Thank you.
Take care, everybody.
A real pleasure to be here. Thank you.